So today I'm going to be doing my horse health check video with my lovely mare Julep here. So this is going to just go over the basics of how you would handle any sort of situation where you need to take vital signs on any of your horses. So the first thing that we're going to do when we are concerned about a horse is we're going to look at their overall appearance to get a better eye-on feel of them. So we're going to look, and as you can see, her ears are up, her eyes are alert, she's very happy and content. So the first thing that I'm going to do, I'm going to just work my way from head to tail for my vital signs, just to give you guys a demonstration of how you should do your vital signs. So the first vital sign that I'm going to talk about is the mucous membranes. You can find them in the conjunctiva of the eye and in the gums. So what you're going to do to check the mucous membranes is most of the time you're going to just check the gums unless there's an issue that is evident in the eyes, in which case then you can check the eyes. But how I like to check the mucous membranes in the gums is I just go ahead and I use my thumb and I lift up her lip, but you get to see in there that they're nice and pink and moist, which is exactly what you want for the mucous membranes of any of your horses. Colors and textures that you would be wary of is if it's fiery red, that is a sign of infection. Brick red or with a bluish purplish tone is going to be a sign of lack of oxygen. If her gums were white or pale, that would be a sign that she is in shock or is anemic. And then if they're yellow, it could be indicative of a liver problem or jaundice. So another thing within the gums that we're looking for is the moisture of them. If it's going to be like tacky and it doesn't like have like saliva in it, then you're going to have a dehydrated horse. And then we have two other vital sign checks that you can see if your horse is hydrated or dehydrated. One of those is called capillary refill time, which is also located in the gums of the mouth. So I'm going to go ahead and I'm going to pull back her upper lip again, and you are going to blanch the surface of the gum. So you're going to take your thumb, you're going to press until it turns white, which you could see, and then it should turn back to pink, which it did, in 1 to 2 seconds. And that would indicate that she is healthy and she is hydrated. The second test that you are going to do to see if your horse is healthy and hydrated is you are going to do a skin pinch test, which you are going to gently take just the skin and you are going to pull it up until it tenses and then release. And it should go back within 1 to 2 seconds, just as the same as the capillary refill time did. And on her, you could tell that her skin pinch was very good. Some factors that can affect the skin pinch is the skin elasticity of the horse. So if it's an older horse that their skin is not as taut anymore, you may be able to pull it back and have it tent. Or if their fur is really fluffy, you may pull back the skin and the fur might tent, but the skin will actually go back. The next vital sign that I am going to show you is the pulse. You can find the pulse under the jaw, which is called the maxillary artery. You can also find it in the radial artery, which is on the knee. And then sometimes if your horse is having issues in their hoof, you can find a digital pulse on the fetlock area. And that, again, you're only going to find if there is any issues within the foot, like founder, laminitis, anything in that area like a hot nail or a bruise, you can find that digital pulse. But I personally like to take the pulse from the maxillary artery because you're not going to have a horse pick up their hoof or move around as much. So I'm going to go ahead and have that happen, and I'm going to have the person behind the camera go ahead and time me for 20 seconds, and I'm going to go ahead and take her pulse and I will let her know when I want the timer to start. And when you're taking this pulse, it's important to know that the structure that you're going to find to take the maxillary pulse, it's going to feel like a noodle. And so you're going to very lightly press on it until you can feel a little beat. So I'm going to go ahead and have my timer start for 20 seconds. So for that, I got 11 beats. So 11 times 3 is 33. And the normal heart rate range that you're going to look for in a horse is 32 to 44 beats per minute. So her heart range is completely normal for her pulse. The next area that we're going to check for a beat per minute count is going to be her heart rate, which you're going to check right below, and I'm going to get my stethoscope out and do that in just a moment. When pulling out your stethoscope, you're going to want to make sure that your earbuds are facing towards you and they're going down into your ears. And you can also test this out by gently rubbing the bottom, which I will show you in just a moment. So I can very clearly hear that I'm rubbing. So now I'm going to go ahead and take her heart rate again. It should be 32 to 44 beats per minute, just as the same as the pulse was. So I'm going to go ahead and have my timer start me for 20 seconds again. Okay. So again, I got 11 beats, which is actually kind of funny because not all the time you will get the same exact number, but you should get around in the same area. So again, 11 times 3 is going to be 33, which falls in between our 32 and 44 beats per minute range. The next vital sign that I am going to take on her is her respiration rate, which you are going to stand either in front of them or on the side of them, and you're going to watch their flank move in and out. You do not want to take it from their nose or their nostrils because that can be very misleading because they can be sniffing or you're doing anything else with their nose or nostrils that isn't really truly respiration rate. So I'm going to go ahead and I'm going to watch her flanks for 20 seconds again, and I'm going to let you know how many breaths that she takes in that 20 seconds. So I'm going to go ahead and have my timer start now. Okay. So I counted 5 breaths in that time, which is 5 times 3, which is equal to 15. The normal breath range, 8 and 20 breaths per minute. And so 15 is very well inside the normal range of what we'd expect for any of our horses. Next vital sign that I'm going to be taking on her is her gut sounds. This is something that you'd immediately take if you were suspecting that your horse is going in a colic episode or has any issues within the gut. So there are quite a few issues that you can hear through gut sounds. If your horse has like a pinging sound, that could be indicative of a gas colic. If your horse has no sound, that can be an impaction colic. Or if your horse has a ton of sound, like a small amount of sound, that could be an indication that your horse is having a hypermodal colic, which means there's too much stuff running through the GI system at once. So I'm going to go ahead and take her gut sounds in her upper left and lower left, and then I'm going to move on the other side to her upper right and lower right. And you're going to very gently press your ear against their flank, and as soon as I laid my ear down on her, I could immediately hear a very normal, grumbly, consistent gut sound within her. And I always like to face pointing towards their back legs so I can keep an eye on what they're doing with their back feet so I do not get kicked. And then I'm going to go lower, and I'm going to press my ear here into her lower left quadrant. And again, I could immediately hear gut sounds because she has very, very healthy guts. And now I moved over to her right side, and I'm going to go ahead and I'm going to check her right side again in the same locations. And again, immediately I could hear gut sounds. And in her lower quadrants, I could hear gut sounds too, and all of them should be around consistent. And the reason that we must check all 4 quadrants is just because one quadrant has gut sounds does not mean all 4 quadrants will have gut sounds. The final vital sign check that I'm going to do is I'm going to take her temperature. The normal range for a temperature is 99.5 to 101.5. So to get the thermometer ready for her temperature, I'm going to go ahead and I'm going to stick my finger in Vaseline, and I am going to lather the thermometer very well so that there's some lubrication on it. Particular to note with this method is that you do not want to just stick your thermometer in the Vaseline, especially if it is specifically for taking temperatures, as you can spread germs and bacteria that way. So now I'm going to go over to her rear end, and I am going to go ahead and I am going to gently lift her tail and push it to the side, all while keeping a safe distance for her, as I do not want to get kicked. I'm going to turn on my thermometer and let it zero out, and then I'm going to very gently insert and tilt it to the right or to the left to allow, to make sure that I am taking her actual temperature and have it snug against the anal cavity rather than having it poked into a pad of manure. And as you can hear, the beep just happened, and her temperature according to this thermometer is 98.3. Although I said the normal is between 99.5 and 101.5, it is totally normal for digital thermometers to run lower. Therefore, I'm going to go ahead and I'm going to take a mercury thermometer and take her temperature again, just to be certain that she isn't a little bit low. It is also an extremely cold day here while I'm doing this video, so that could be another reason why her temperature is low. And as you saw, to clean this thermometer immediately after, I just take her tail hairs, wrap it around, and pull it so that the Vaseline comes off. But after that, you are going to want to take Novosan or alcohol and clean the thermometer, as again, not to transmit any germs or bacteria. I have my mercury thermometer, again, where you're going to take the Vaseline and we are going to very well lubricate the tip in which we are going to insert into her rectum to make it a more pleasurable experience for her rather than inserting a dry thermometer. And I am going to go ahead, I'm going to shake this down past 98 to get a true read. When you are shaking this down, you are going not to want to do it anywhere near anything that your mercury thermometer can break. So I have it now shaken down past the 98 mark. So I'm going to go ahead and I'm going to actually stick this in the tail hairs first, my little clip. Because this is a thermometer that we leave in a lot longer, it's going to stay in the rectum for 3 minutes. To get the most accurate read, we want to put a clip in so that the thermometer doesn't get sucked up into the anus. So I'm going to go ahead and I'm going to insert, and again I'm going to tilt, making sure to only hold it by the head or the bulb of the thermometer, because I do not want it to read my temperature rather than hers. And I'm going to be back in just a moment with her temperature. Now that our 3 minutes is up, and we've had an accurate read of where her temperature is, I'm going to gently remove the thermometer, pull her tail clip off. I am going to take her tail hairs and wrap my thermometer in it and gently remove all of the Vaseline. And now I'm going to read her temperature. According to this, it's around 99.4, which is normal for her. Although the range is 99.5 to 101.5, it is totally normal for your horses to have their own specific average or normal. Thank you so much for watching my horse health check video. I